Welcome to the village. So we're going to talk a little bit more now about Erin, and your experience with giving birth was quite unique. Tell us about it.
So, I'll start by saying that I was a labor and delivery nurse before I got pregnant with my first child. And
how many children do you have?
I just have 2.
Okay. Good amount.
Yeah.
It's a fair amount.
Yeah. So I had, I felt like I knew a lot about labor and delivery. And I did a lot of preparation on top of what I already knew, just being a labor and delivery nurse. And my first birth, it was a good lesson in remembering that you can prepare as much as you want, but you still have to be open-minded to things not going exactly the way you planned, because that's the beauty of labor and delivery, is that we don't know exactly how it will go. So that experience was fine. It just didn't go exactly how I wanted. It was really long, and parts of it just felt disappointing to me in various ways. I had a great labor team around me. I just would have made some different decisions looking back on it. So my second birth, I decided to have my baby at home, which was so fantastic in so many ways. And yeah, I had a midwife who was excellent. I had the most excellent prenatal care. And when labor started, it sort of kind of started slowly and gradually, but it was so low key and easy because I was home and there wasn't pressure to go to the hospital. I just was home with my family, going about my day. In early labor, my contractions were maybe like 7 to 10 minutes apart. We decided to go for a hike. And so we went for like a little 2-mile hike.
After you knew you had started labor?
My contractions had started early in the morning, but they were irregular. So they were 7 to 10 minutes apart. Like Brittany said, active labor would be 3 to 5 minutes. So I knew I wasn't quite in that active labor, but I knew things were starting. And, I was a week and a half over my due date. So I knew it was bound to happen, any day. And it had definitely started in a rhythm that was regular, but just not super close together.
You weren't at risk of giving birth on the trail.
Right.
And Erin did the perfect thing, which is moving and keeping your body moving. Yeah. And so going for a hike in early labor isn't necessarily a bad thing.
Yep. So moving, changing positions. I was really trying to, I heard this advice years and years ago, but ignoring labor until you can. So I pretty much was just kind of going about my day, ignoring my labor. Occasionally I'd have a contraction that was painful enough that I couldn't really talk or move through it. And I'd have to stop and focus and take some slow breaths. And then it would go away and I would be okay again. And I continued to go through my day. So that's how I went about pretty much the whole day. And then around dinner time, things started to get uncomfortable enough that I needed to get in the bath. Another great coping mechanism in early labor before you go to the hospital, where you're uncomfortable enough that you need to really focus on getting through. A bath is always a great thing. So I took a bath, and my husband was timing my contractions, and they were regularly that 3 to 5 minutes apart.
What were you doing while you were contracting? Where was your focus?
So I
was. Were you in the bath the whole time, or were you in and out of it?
I was. For I would say for an hour and a half or so, I was in the bathtub in my house. And I had music playing and I was just closing my eyes. And if I had to kind of moan or hum through a contraction, that was really helpful. But really trying to rest and slow my breathing and hum through a contraction. Contractions really
energy conservation.
Yeah, energy conservation, and just remembering that contractions, even when they're intense, regular active labor contractions, they really only last about a minute. Mm-hmm. And the peak of them, the most painful part of them, only lasts about 30 seconds.
And a lot of people, their first instinct, which is not necessarily a bad instinct, is when you're in pain, is to fight it and pay attention to it.
Or tense
up because you're like, oh, look, I don't want that to happen. But know that with labor, that's normal. So if you know that, they're going to happen. They're coming regardless. If you just let them happen, which is sometimes a hard mindset to get into. But if you can get into the mindset that they're doing a job for you and you can just relax and let it happen, I feel like it'll be a little easier to get through them versus trying to fight every every single
So like
contraction that
anything in
comes.
life that kind of represents accepting
Mhm.
something's happening.
Yeah.
So you can't always fight things. You have to do, but it's healthier for you and helpful for you to accept things. And so you're accepting that this is pain.
Yeah. And almost
More.
like surrendering to it.
Yeah.
Okay, that's a good word.
Yeah.
Letting it happen.
Letting it happen.
Not
Not
denying
fighting.
it, maybe not focusing on it, but focusing on being at peace through it or relaxing as much as you can through it. So you said visualizing.
Yeah, there's so many good like visualization techniques out there. That's kind of a common birth coping tool that you see in a lot of different birth classes and stuff. But, you know, for some people it's like visualizing riding a wave and kind of floating on top of the wave, or visualizing like a flower opening. Everyone's going to find their own kind of
People, I've
unique
seen
thing.
this flower thing on some sitcoms, and they tend to kind of be sarcastic about it or funny about it. But it seems like if you think about it, it's a real thing. And
Yeah,
what's more feminine than giving birth, right?
right.
Well, so it's really interesting that you went and being a labor and delivery nurse and having a baby the routine, standard way. You must have gone through a whole thought process, and to make this is a pretty huge decision.
Yeah.
To decide to have a baby at home. Did you feel scared about making that decision? Did it just feel like the right thing to do?
I mean, I would say that like being a labor and delivery nurse, I'm also just like a real big fan of birth in general. So it's like kind of a birth junkie type thing. I love hearing about people's births. I love talking about birth. I love all things birth.
Birth is your thing.
Yeah, and
that's why you said only two, because there's many more coming. I love birth.
No, I mean I would have 100 kids. I just can't raise 100 kids. The raising part is the hardest part.
Is that physiologically possible?
Right. Yeah.
Maybe.
You have multiples.
Right. You could have multiples.
Yeah. Oh, that's true.
Well, I don't know if I want to have a multiples pregnancy. Yeah. That's hard. Yeah, I thought about it a lot. I thought about it even before my first pregnancy. I just kind of wasn't. I wanted. It's all about like what you feel safe and what you feel most comfortable with. And the idea of having a baby at home felt safe to me, but not for my first baby. That doesn't mean that there's not lots of first-time moms who do have their babies very safely and successfully at home. For me, I always wanted a home birth. I dreamed about having a home birth. I thought it was cool.
Yeah, it does sound pretty cool.
Yeah. And it just
pressure aspect.
Yeah. And also it was perfect because it was kind of the peak of COVID. And so it offered the chance to have a baby outside of the hospital and have more than just one person around me supporting me and not having to be in the hospital during COVID.
It's a great word you use to describe it. Just safe. Whatever feels safe for you. You're having a baby, you need to feel supported, comforted, and safe. So what environment probably takes a lot of exploration and education and support. And it's good to have those support people. Yeah. Is there, I think some moms think it's just the craziest idea because shouldn't you be where there's medical equipment and doctors and your baby should be seen by a doctor? Like, how does that work then? So what is the benefit of then the hospital? Why doesn't everybody give birth at home? Why do we have hospitals? Like, what's the benefit of the hospital?
Well, I mean, I think there's lots of benefits to the hospital.
Yeah, I mean, just like you said, there's always all those things readily available in case of an emergency. I think it does depend on where you live, how close you are to a hospital. Erin, thankfully, does not live too far away from hospitals. Whereas versus if you live out in the middle of nowhere, and you might not be the best candidate for a home birth. I'm not telling you that you're not, but these are things that you talk to midwives who service people for home births, and they talk to you about that and all those things. And, you know, pros and cons. And again, are you a good candidate? Just like it for anything else, if you're thinking of like a surgery or a procedure or whatever, they're going to talk to you about you as an individual and whether or not you're a good candidate for something. That's the same for home birth versus hospital birth. Again, is your baby head down or is the baby breech? Do you have preeclampsia? Do you have gestational diabetes? There's a lot of different things that are going to help push you in a direction that's going to be right for you. If Erin wanted a home birth, but then ended up finding out she had a ton of complications, obviously it would be safer and better for her to go to a hospital. Thankfully, she did not have any complications, and she had a lovely delivery. I was very thankful to be there. And
Brittany was a key part of my
That's
delivery.
awesome.
And
It's good to have a labor and delivery nurse
and
handy.
it was amazing.
Well, yeah, and that's the key. It's all, I would say the biggest thing is, where are you going to feel safest? And the idea for some people is, if it's crazy to you and doesn't feel like safe or seems irresponsible or whatever, then home birth is definitely not for you. And that's okay. Yeah, I think it's all about where you feel safest, looking at your own situation, weighing all the pros and the cons, and then making an informed decision.
And just like, again, anywhere else we talked about earlier, picking the right support people and what you want at the hospital. That's the same for if you decide a home birth. So for Erin, she had her husband on board. Obviously, her husband had to be agreeable, hopefully, to having a delivery at home. And then she, again, thankfully asked me to be there. And I was so excited because I have always wanted to be at a home birth. Again, I'm another birth junkie. I'm a little bit what they call crunchy granola. I like all things natural. I'm a little bit hippy dippy. So I was very excited to be at that.
Well, it's nice to know members of the medical community are like that.
Yeah, some people are interventional, and if that's your thing, more power to you.
There's a spectrum of your beliefs and your behaviors. I can be like that sometimes too. I think some of my families like that I recommend a lot of essential oils and things like that. Which actually I wanted to ask you, in the bath, do you recommend an essential oil in there while you're laboring? And is there something with the aromatherapy, would that fit hand in hand?
I think diffusers are good.
Yeah, so I think you have to be real careful about, essential oils are so great, but they can be potent, and they can actually, you have to be real careful when you're applying them to your body or putting them in a bath. And for me, I use essential oils. I mostly diffuse them, and I don't know enough to recommend, or even for myself, I didn't feel comfortable applying them to my body. So what I did is I diffused, in my particular situation, I was diffusing lavender and clary sage. Those were just comforting oils to me. And
but not in the bath, but just around.
I didn't put them in the bath, but I don't know enough, so I can't.
Yeah, I don't know about really any studies that say one way or another necessarily. I would say it's usually
it's going to be studied.
I would say it's usually safest when it comes to actually submerging yourself in a bath, pregnant or not. I mean, we worry about we even tell people not to necessarily do bubble baths for girls because the likelihood of infection and stuff. So that's the same thing, especially if you're pregnant, and especially if you get to a point where your water's broken. You don't want to have to be worried about that. So again, diffusers are great, or even maybe smelling, an oil dropper, but I probably would keep your tub water just water.
Okay. That's, don't take any risks.
Yeah.
So that's really good information. Okay. So now you've given birth, you gave birth.
Yeah. And so a nice thing about being home was I gave birth I had a birth tub, and I gave birth in the water, and then the baby was born, and we got out of the bathtub together and got right onto the bed, and we got to do really truly uninterrupted skin to skin for a while. And those first hours after baby's born, they have this huge rush of adrenaline and oxytocin, and so we call it the golden hour because they're so awake and alert. And pretty much any baby we see, they really are so eager to breastfeed. Even babies that the moms are choosing not to breastfeed, you can see them rooting and looking to latch onto a nipple. So it's so sweet. And Pearl, my daughter, I had her skin to skin, and I think I even latched her in the tub before I even got out of the tub. And
she was just ready to eat.
Totally, I latched her right away. I think I was waiting for my placenta to be delivered, and she was rooting, and she just latched right on and nursed. And then after my placenta was out, we got into bed and we nursed some more, and we just got to be uninterrupted. There was no taking the baby away or any nurses really even doing. The midwife, I think, listened to her right on my chest, but she wasn't doing regular vital signs or anything. It was truly
wiping
No, absolutely.
down.
There was nothing like nobody even really touched her for a while except for me. And that was great. So I think those first moments breastfeeding, the first moments being able to be skin to skin and really establish breastfeeding in an uninterrupted way, whether you're at home or in a hospital, if we can honor that natural hormone cascade in both the mom and the baby, it can really affect whether breastfeeding is successful or not.
Absolutely.
That's actually very true that they do we all recommend, pediatricians and the OB team alike, that skin to skin and breastfeed within the first hour
Right.
is going to set you up for the most successful breastfeeding.
Yeah.
And obviously, again, there's certain emergency circumstances
Right.
where if that can't happen, we can help and support with still trying to make that a successful journey for you.
Yeah.
But
And
if you
always
can-
coming back to that. Like if
Yeah.
the baby needs attention right away, obviously that takes precedence. But then as soon as the baby's stable and mom is stable, getting those moments skin to skin really do make a difference.
And that skin to skin doesn't have to not happen again after the first hour. And people are very excited to dress their babies and do all that, and that's perfectly fine. But know that you can always still continue to do skin to skin, put baby to breast, take a bath with your baby and breastfeed with your baby. Just again, touch is so important. And
I say it's like
create so many
it's like a
developmental
mommy
milestones.
superpower
yes.
to be skin to skin with your baby.
Yeah.
And I think moms really, I mean, I found it personally with my own kids, but I think moms do find it even in the first couple of days. But beyond that too, is that when you have a fussy baby or a baby that's inconsolable or whatever, if you get naked with your baby and put that baby right on your chest skin to skin, it's like a magic power. It's a
Yeah.
superpower. It calms that baby right
Yeah.
down.
It's a natural mammalian quality
Yeah.
to have that ability.
My 7-month-old was sick last week and I just couldn't make her happy. And so I stripped her down and she and I got in the tub together and it was like the only thing that worked.
And
So it's still,
sometimes just knowing your mommy's there.
people get very nervous about like holding their baby too much. I'm going to spoil the baby, or they're using me as a pacifier. And those just simply aren't true statements. Babies have a natural instinct of survival. And again, creating your milk supply and also just being able to bond, like Erin said, that is your superpower. I think you should be proud of it and take that baby and do all the things that babies do, because they're only babies for short periods of time.
Yeah, especially when they first come out, they've been used to being in you, around your bloodstream, your body, and eating your food, taking your vitamins, just being a part of you. So to come out in the world is a bit of a shock. So they do want to be with their mom or dad, or they need that support, that comfort.
It's just simply not possible to spoil a baby. Babies don't have that mental capacity yet of, manipulating and knowing those types of things. Again, babies cry and ask for you and are comforted skin to skin because that is a natural instinct for them to want to be with mom, to smell mom, to be near mom, to be near the breast, and to breastfeed as much as they want, to grow and develop that little brain and those emotional connections. And the more you do that, and the more skin to skin you do, and the more you respond to that baby, the more emotionally inept that baby is going to be as they get older.
Yeah, exactly. They feel safe. They feel they have more trust. And I think, the tough love and the crying it out can happen a little bit later on. But the first month, maybe even 2 months, I think, like what you said, it's important. You're not going to spoil them. You're just going to love them. And and so what else then with breastfeeding? I mean, this is another magical superpower, this magic milk. I think a lot of moms have heard about, breast is best, and the antibodies and the immunity and the bonding. Some of them may not realize that pregnancy weight loss happens quicker too. But there are other benefits. There's some benefits I've read about. Decreased risk of diabetes and certain cancers in children later on in life. we know about the ear infections and allergies. Is there anything else that is important that moms should think about to consider breastfeeding?
Many studies have shown that breastfeeding helps reduce the risk of sudden infant death syndrome.
Right.
Also reduces the risk of diarrhea, which is one of the leading causes of death in newborns throughout the world. Just because, again, the milk is specifically made for them.
Right, exactly.
There's going to be certain circumstances, of course, you can't predict everything. There's going to be certain circumstances where babies have an intolerance or an allergy or whatever. But almost always, your milk is going to be specifically and perfectly tailored to your baby, unlike formula. And that is not to shame people who use formula. Formula was created for a reason, and it is a perfect substitute if that is what is needed. But to know that your body is so smart and so cool how, again, it creates that milk perfectly for your baby, the right amount, as long as you do baby-led feeding, which is you feed the baby whenever they want, that baby's going to get as much as they actually need. And then, again, that same thing with antibodies. If your baby's sick, it's so cool how your milk knows that, your body knows that, and it changes its consistency and what it has in there to help your baby. Also helps with babies' just overall gut flora. The minute you introduce formula, it's already changed the baby's gut flora, which I feel like is a pretty popular buzzword right now, like gut health, gut flora.
Yeah, so huge probiotics, prebiotics.
Yes, and so doing just purely breast milk straight from the start is going to set up your baby as an adult to have great
this
gut
is a
health.
lifelong
Yes, this is a lifelong choice that you're making for your baby. And again, I, as a labor and delivery nurse, and just as a woman, want to say that you are supported in whatever decision you make.
Absolutely.
But just like I said from the beginning with anything, in order to make a decision, I feel like you have to be informed of all things. Right. And so me telling you these things is not to shame you. It's just so you have all the information, you can make that informed decision of whether or not breastfeeding or formula feeding or mixed feeding is going to be a choice for you.
There's always mixed feeding.
Absolutely. And just know that some people get very nervous, like, oh, well, nobody in my family breastfed or it didn't work for them, so I'm not going to be able to breastfeed. Breastfeeding and birth are not hereditary. You and everybody else are an individual person. And so if it's something that you even think that you might want to possibly try, I say give it a try.
Just try.
You don't know
There's
until
no harm
you do
in
it.
trying. Exactly. And I think that's very true. Moms think about things and they make decisions ahead of time. And some things you can go with the flow. And if it doesn't work, it doesn't work, but you try. I think that's the point here of letting moms know the benefits. Not to say you have to do this or else you're a bad mom. That's not true at all. It may be too hard. It may be impossible for you for one reason or the other. But if you give it a try, it might just work out fine.
Yeah.
But do your research. Talk to people who know what they're talking about. Talk to people who've been through it or people who have studied it. And there's lactation nurses too.
Yep, but like I'm a lactation counselor. I'm a certified lactation counselor, and almost all labor and delivery nurses have some training in breastfeeding, but some of us take the extra steps to get a little more in depth and learn a little bit more about it to help with support. But basically the biggest thing is just learning to, again, not medicalize breastfeeding and to just trust your body and mainly trust your baby. So if you learn from the beginning what feeding cues are for babies, so in those first 2 weeks, which is the newborn period, we know that babies are awake only because they want something, which 9 times out of 10 is they're going to want to eat. So if they're awake, they want to be at breast. Yes, and those are those early feeding cues. If you're waiting till baby gets upset, you probably already missed some of those feeding cues. But so if you know that now, and I'm telling you that now, so now you know it, if you just trust your baby to tell you when they're hungry, then you're going to be set up for success.
Yeah.
And if you trust your body to do what it's got to do, because for some people it's really hard. One of their reasons why they don't want to breastfeed is because they can't see it. They can't measure it. They don't know if baby's getting enough. So I promise you, if you learn those things, which we'll teach you at the hospital, or you can learn online, take a class, whatever works for you. You learn what the feeding cues are. You learn about positioning. From there, it's really just trusting your body and trusting your baby. If you're putting baby to breast and baby's satisfied after, they fall asleep, they're peeing and pooping, they're gaining weight at their appointments, all signs point to they're getting plenty.
Exactly.
Which again, for some of us, we're a little bit type A or whatever. That's a little difficult.
Yeah.
But I'm urging you to give it a try and give yourself that permission to trust yourself and trust your baby.
Yeah, that's great advice. Trust your baby. Your baby's a little person with their own little brain and their needs, and they know how to tell you what they need. That's awesome advice.
Yeah.
So breast really is best, as they say.
Yeah. There's definitely a ton of benefits to it. Again, I always like to preface because there's the whole fed is best movement. I think that's a little problematic only because it glosses over all of the things and choices that come with, again, whether it's breastfeeding, formula feeding, mixed feeding, doesn't matter. I think fed is best kind of just negates all of the things and all of the cool information about all of it, not just even breastfeeding. But I do think we all know that there are many, many benefits to deciding to exclusively breastfeed. And I think it's more we need to encourage to educate ourselves and feel empowered and feel like you are a grown adult woman with a brain, and I know you do, and that you have the capability to make choice. So that's the only thing that I like to say that in regards to the fed is best, because I do think it just glosses over a little too much of how capable we are of being able to make choices.
Yeah.
So.
Absolutely. Yeah. We can make choices and make choices for our children. I think some quick resources that parents can use, especially when we say do your research, but do it smartly. Google searches are good, but it depends on which website you're going to. I think some of the best websites for breastfeeding in particular, La Leche League, they say is a good one. LALECHELEAGUE.com.
Yep, LHA League.
Yes.
And a lot of them tend to have like meetings and groups really all over. No matter where you live, you should be able to find someone close to you.
You pronounced it a little bit Spanish, and I went with a little bit French, so I don't know which one's right, but it's definitely there. And the other, of course, the American Academy of Pediatrics has a lot of resources. AAP.org, that was an easy one. And ACOG, the American College of Obstetrics and Gynecology.
And then I would definitely recommend WHO, the World Health Organization, has a lot of great resources as well.
Yes, they have a lot of information about formula too, like breast and formula and how to store and how to properly prepare. So they have a lot of good information. Just that's a lot to think about.
And again, feel free to ask your obstetrical provider, whether that's a midwife or an OB doctor, because more than likely the hospital that you're delivering that, or if you deliver at home and you're using a home delivery midwife, they will have resources for postpartum, whether that's mom support groups or certified lactation counselors who take appointments, doesn't matter. There's always someone somewhere near you that you're going to be able to call for support.
Yeah. You're never alone.
Yes.
Yeah, that's why it takes a village. So, that was a lot of information for expectant moms, new moms, and there's always going to be more questions, but what should we kind of leave everyone with here, do you think?
I think the big message overall is to, again, trust your body, trust yourself, trust your baby, and feel empowered to know that you have so many resources out there to get as much information as you want and to ask questions and to know that you have choices. And I feel like there's times where we don't realize that we have choices and that we just do what we have to do. But thankfully, we do have choices.
Yeah, and we can ask questions and we can make informed decisions. And we need to feel safe. And we should always feel safe and protected. And
be excited.
And congratulations. Be excited, yes. Congratulations. Being a mom is really unique, exciting, scary, and wonderful. So thank you, moms.
Yeah. Thank you for listening.
Yes. And thank you, all my labor and delivery nurses for being here today.
Yeah, thanks for having us.